Hi, this is Dr. Chukura again with Foot and Ankle Clinic of Albuquerque, here to do a laser therapy on a patient who is gracious enough to have me do it on her. We do laser therapy here in the office quite a bit. In fact, the gracious patient I'm with today, I gave her a cortisone injection. You can see in here she's got this bone spur that's been quite painful for her for a while, but she has pain in here and also some pain in the joint. We did a cortisone injection about a month ago. It lasted her about 4 weeks, gave her some good improvement, but it recurred. So she's coming back today. We talked about cortisone again, but I prefer not to overdo cortisone. In other words, just do what is needed. So we did a cortisone injection one time. It worked for her, but no long-lasting relief. So we're trying something that is effective, proven to work. It's FDA approved. This is a class 4 laser. No injections, no incisions needed. And the way this works is it decreases inflammation, increases energy within the mitochondria in the cell. So what it's really doing is increasing the energy for the cells to heal. And it also causes somehow, we don't truly understand how this works, but it allows your body to create pain relieving chemicals, so that can also help provide some pain management in this area. It's FDA approved for pain management for osteoarthritic pain, inflammation, tendonitis, and all these areas. So, she works and doesn't really have time to take off for surgery at this point. And so I don't believe in continuing to do cortisone. We're going to try this because it works 85% of the time. And this is something I do a lot in the office. I'm very pleased with it. So we're going to try it, and we're going to start it right now. I am doing about 25 watts of energy on her, and this is going to heat up. This is not a cold laser, so she will feel some pain. It's not just going to make the area feel good, it's actually delivering energy that's going to allow the cells in here to have adequate function. It increases the energy there and allows them to heal, to recover. And so this is more of a regenerative therapy. Is it heating up? Does it hurt?
No, it's heating up.
Okay. Is it tolerable?
It's tolerable.
Okay. So we're going to climb up to about 15,000 joules. That's a lot of energy through here. And you're going to start noticing it heating up. Right now we're only at about 1,200. It'll take me about 9 minutes to climb up to finish up the therapy, but it'll take me about 7 minutes to get to that point. So if you start feeling a lot of pain, let me know. So these things do heat up a little bit, and that's okay. It actually gives a very calm, soothing feeling for some patients who have this. They feel really, makes them feel real relaxed, and it feels good. But we try to be really careful. As you can see, I'm moving this up and down because you don't want to keep this in one area. It can actually irritate the skin by causing some sort of thermal injury. So like I said, this is a class 4 laser, FDA approved for managing pain. We do a lot of this here in the clinic, and we are very pleased with the results. And I would say my results with this is really spot on. I would say slightly more than 85%. I've used this on patients that have amputation stumps that are very painful from nerve entrapment, a nerve that is caught up in the tissues from the scar, and it causes a lot of pain and burning. So we've had some good results with that as well. Plantar fasciitis is a good one. Achilles tendonitis back in here. Painful surgical scars works great. In fact, we also use this on fungal nails, but that's a different video that I'll have to post. So we basically just do this up until we feel in certain areas where the pain is less, and I determine that by palpation, by feeling. And I'll show you what I mean here in a little bit. So I'm going to pause this and just feel. How does that feel?
It hurts.
Still hurts? Okay, and that's okay. Does it hurt as much as before?
Not as much as before.
Okay,
you
good.
can touch it now at
Good.
least.
So we've just gone into this about 7 minutes, and I have I still have, sorry, I have 7 minutes left, so I've gone into this about 2 minutes, and she's already feeling some relief, and so we'll just keep on going. So again, we're building up energy, and as the energy rises to the max, which is close to 15,000 joules, which is 15,000 joules, by the time we're done with this, there will be actually really good improvement in the pain she's having here. So I just go hit really all the soft tissue structures, the ligament, the capsule, the bone, the skin, everything around this joint in order to get adequate penetration. And as I scan this, eventually I'm going to focus more on this area. The goal is not to remove the bone spur, which is part of the pain, or to correct the bunion. It really just helps to decrease inflammation around this area that's real red, which is a bursa. So it decreases that inflammation, and by so doing gives immediate pain relief, even with the first treatment. Anyway, we like this modality, and certainly feel free to check us out on our, you can follow us on Instagram or Facebook. Our website is onefootandAnkle.com. That's number 1, foot and ankle, all one word.com. Again, my name is Dr. Chupura. We'll continue rolling this, and I just want to go up to maybe 7,000 joules and then see how she feels with this. How are you feeling?
It still hurts. It hurts more on the side right there. But not as much as when I first got here. Like when I first got here, you couldn't even touch it. So.
Good. All right.
Yeah.
I'm glad it hurts less. And so that's
feel it getting hotter as well.
Yeah, that's good. That's kind of how it'll feel. So one other thing with this, and she brought up this thing that I had, this point that I hadn't addressed, is we recommend 6 of these therapy sessions. Each therapy session builds on top of each other, so it's incremental. So the first one, second one, the third one, and they build on top of each other. So yeah, she'll have some relief today. I don't expect the pain to be 100% gone today. That's normal. And then I expect her to have continued increasing relief. So your pain relief will get better and better as we do more and more of this. And I recommend 6 of these, as we talked about. Yes. Now we're doing this one. We're also going to do this one eventually. We will not roll the camera for this. But I just wanted you to get a feel for what this is like, what this looks like, and the fact that you can actually give patients who have recalcitrant pain, meaning pain that you give them injections. You can't keep on doing injections in an area because it can make the capsule, the tissue, even the skin look thinner. It can cause more harm than good by continuing to do cortisone. So I prefer not to do a lot of cortisone. Really, I do 1 or 2. If no improvement, I switch immediately to the laser therapy or shockwave therapy, which we do here in the office. But for all intents and purposes of this video, we do laser, and each treatment builds on top of each other. And most people, like I said, in our clinic here, I think we have close to 90% pain relief before we even get to the 6. So let's see here.
Wow.
How does that feel?
Feels a lot better.
You can capture her so she can.
Yeah, I'm like actually smiling.
Yeah, there you go. That's awesome. That's why we love this. That's why we love this. And we still have 4 minutes, and we're only at 8,700 joules. We still have to climb up to 15,000. So you heard it here. Basically, we love this, and thanks for watching. And we'll keep you posted with other videos. Bye now.